Good afternoon, dear audience. In my presentation, I would like to perform to you the cognitive aspects of multiple sclerosis. My PhD topic is the prevalence of cognitive impairment and its prognostic significance in patients with multiple sclerosis. I am a neurology specialist in Bajcsy-Zsilinszky Hospital, and my supervisor is Zsolt Mezei, who works at the Department of Neurology, Semmelweis University. In our research field, our vision is to give a comprehensive epidemiological overview in MS cognition by highlighting the special importance of cognitive impairment in treating of multiple sclerosis. And thus, our mission is to integrate cognitive screening into MS care and therapeutic decision making. And to achieve this goal, we have got two main topics. The first is a meta-analysis about prevalence of cognitive domains impairment in different clinical subtypes of multiple sclerosis, to answer the question, how many MS patients are affected by cognitive impairment? And the second one is a registry, establishment of an early stage registry, to answer the question, what are the prognostic factors of subsequent cognitive impairment in multiple sclerosis? So let's start with the first question. Multiple sclerosis is a neuroinflammatory disease with demyelinating lesions in the brain and in the spinal cord, causing various neurological deficit signs. The disease has four main clinical subtypes. The clinically isolated syndrome as an early stage of the disease with one isolated clinical attack. The most common form is the relapsing-remitting multiple sclerosis with relapses with neurological signs and with quiet periods in between. The primary progressive multiple sclerosis with disease progression at the beginning, and the secondary progressive multiple sclerosis, which developed with relapsing-remitting multiple sclerosis with late disease progression. And cognition, our way of thinking, which is a special human characteristics, has five main neurocognitive domains: the memory function, executive function, attention, language, and visuospatial perception. And we are able to measure these neurocognitive domains by neuropsychological test batteries. We have chosen the BRB test battery because this has the highest sensitivity and specificity. But the problem is so we have no uniformized evaluation score systems, and there are many different definitions and many different meanings of cognitive impairment in multiple sclerosis based on these different cutoffs and different used tests. So we know that the prevalence of overall cognitive impairment in multiple sclerosis patients has been reported to range between 40 to 70%. It's a wide range, and our study may add the comprehensive meta-analysis in regard of cognitive impairment in multiple sclerosis with each clinical subtypes and with different cognitive domains, with different definitions and different causes of the wide range reported cognitive impairment. So our aim is to give a broad epidemiological study to the MS cognition research area by clarifying the differences in concepts and definitions. And how can we achieve this? We will have four highly detailed parts of our meta-analysis: overall cognitive impairment in multiple sclerosis, overall cognitive impairment in different subtypes of multiple sclerosis, different cognitive domains impairment in different subtypes of multiple sclerosis, and finally, age, gender, disability, disease duration, education, and treatment-drive cognitive impairment in multiple sclerosis across the different clinical subtypes. Here you can see our clinical question: what is the prevalence of cognitive domains impairment in different clinical subtypes of multiple sclerosis? And also you can see our systematic search and our flowchart of selection. We have more than 300 eligible full text. And here you can see our incomplete results. At the left side of the screen, you can see the memory impairment, the prevalence rate of memory impairment measured by PASAT-3 test, the Paced Auditory Serial Addition Test 3. And on the right side of the slide, you can see the language impairment rates measured by word list generation test, also both of them measured in relapsing-remitting multiple sclerosis. At the bottom of the slide, you can see the overall impairment in memory function and in language function, and you can see that higher prevalence rate is in the memory dysfunction than in the language function. But if you concentrate on the different cutoffs, you can see that there are identical cutoff groups in the literature. The most common is the 2 standard deviation below mean normative value. And if we analyze this subgroup, we can see quite similar numbers than in overall impairment in these functions. If we see 1.5 standard deviation below mean normative value, you can see reversed numbers of prevalence rate. The potential reason is in the language impairment, the 1 standard deviation group, we have got just 1 study, so this result is not very comparable and relevant information, relevant results. If we see a third comparable groups with below 5th percentile of controls, we can see a quite similar number in these 2 groups. The potential reasons are the heterogeneity, which is different in the 5th percentile group, and quite similar in the 2 standard deviation groups, which reflects to the overall impairment in these functions. So our conclusion is, if we want to know the reason why the reported range of prevalence of cognitive impairment is so wide in multiple sclerosis, first we must analyze the differences of populations, the differences of used test series, and the differences of cutoffs in failed test results. And finally, with our findings, we will be able to create a recommendation for the suggested tests and cutoff values based on our studies. And we arrive the importance and the huge grade of our work, because if we can answer the question, what is the most affected subtype and cognitive domain in multiple sclerosis, and what does the degree of cognitive impairment depend on, we have a huge impact on practice, clinical practice, for neurorehabilitation programs and pharmacological decisions. And also by answering the question, what is the recommended definitions to use in order to assess cognitive impairment in multiple sclerosis, we have impact on the research programs planning for future studies. So the strengths and limitations. Strength first is, this is the first comprehensive meta-analysis over the entire world in prevalence of cognitive impairment in multiple sclerosis. It helps us to better understand the context of cognitive impairment, and it's a comparative analysis of different definitions and populations. And the limitations are, most of the data are from relapsing remitting multiple sclerosis type, of course, because this is the most common type of multiple sclerosis. And maybe we have greater error and bias potential due to very diverse data we have. So let me move on my second project, establishment of an early stage registry. One of the biggest challenges currently associated with research of multiple sclerosis cognition is to find a prognostic marker which can be sensitive to progression of cognitive impairment. And MRI scans are used in clinical practice to assess the progression of cortical atrophy related to cognitive impairment, but it still faces a number of challenges. I mean the differences of devices, softwares, and the differences of measurements. And the measurements are very expensive sometimes. That it has, therefore, it has not been become a part of the clinical routine. So our aim is to find an easily usable, inexpensive prognostic marker in the early phase of the disease, which predicts reliably the further progression of cognitive impairment. What does it mean, early MS? Early MS means clinically isolated syndrome and patients diagnosed within 1 year. We will measure the demographic characteristics of patients, and we will measure also the cognitive affective aspects of the disease by neuropsychological tests, series, and we collect data about MRI scans and liquor findings. We plan to screen our patients annually. And finally, our aim is to find a widely usable prognostic marker for further cognitive deterioration of multiple sclerosis. And also, hopefully, finally, we will build up a prognostic score system in the very beginning of the disease. So for summary, with these 2 studies, our aim is to understand the context of cognitive impairment in multiple sclerosis. Thank you for your attention. With Santiago Ramon y Cajal's words, in summary, all great work is the fruit of patience and perseverance combined with tenacious concentration on a subject over a period of months or years. Thank you.
Congratulations, Kat, it's fantastic. I just have a question regarding your second project, your registry analysis. What is the most ambitious plan of yours with that project? I mean, nowadays, you know, if you want a prognostic tool, then AI is the best. I mean, if now you plan to gather data, collect data, then you also have to think about possible artificial intelligence software to analyze it and see, actually, to put together the clinical data, the imagistic data, and also the laboratory ones to see actually what can be the best prognostic tool.
Yes, thank you. It would be our final goal to collect, to put together data and to create a prognostic score system. But first, our plan is to find a clinically usable prognostic marker. And at the end of our work, hopefully we can create by artificial intelligence, yes, maybe. But first, our plan is to find a prognostic marker, or more than one, of course, prognostic marker, which can be useful in the clinical practice. So this is our main goal.
And as I see, for the second project, you are going to initiate a study on early MS. And I haven't seen that you included radiologically isolated syndrome in your study.
Finally, in the meta-analysis, I will conduct the radiologic isolated syndrome. But yes, in our clinical study, at this moment, we don't plan to conduct or involve. But yes, it's a very good idea, and we will consider to involve them.
Actually, I would definitely encourage that, because we have almost no information on the cognitive condition of patients with radiologic isolated syndrome. I think it's a very interesting topic to pursue.
Yes, sure. Yes.
How many new patients diagnosed in multiple sclerosis in Hungary? Do you have specific data? And do you consider that it's feasible to establish a national registry?
Sorry, I don't enough information nationally how many patients diagnosed in 1 year in multiple sclerosis. I just know especially in our center. And what was the second question? Sorry. National, yes, it would be better, and it would be very nice if we have a national registry, and we are working on, the society is working on currently.